This is the Roscoe's Wetsuit Neuro Podcast, the neurohacking show where we teach you how to optimize your cognition. Keep up to date at roscoeswetsuitneuro.com. Now here's your host, Toby Passman.
All right, we have a special guest with us on the show today, Dr. Emily Rowe. Dr. Rowe graduated from the University of Miami Miller School of Medicine in 2004, and after a brief time in the field of internal medicine, she became frustrated with the Western approach to illness. She realized that she was being trained to treat the symptoms of disease and its end-stage complications while failing to address its root cause. Inspired to find a comprehensive and definitive way to heal her patients, she went back to school and completed her master's degree in Chinese Medicine and Acupuncture in 2009. Dr. Rowe's practice melds Chinese herbal medicine and therapies with modern Western diagnostic evaluations, nutritional supplementation, dietary, and lifestyle modifications. So Dr. Rowe, super excited to have you with us on the show today.
Thank you. Please just call me Emily, though. I thank you for having me, Toby. I really appreciate being invited to be a speaker on your podcast.
Of course, of course. So tell me a little about kind of your time, the brief time that you spent in internal medicine, and just kind of what that process was of becoming a bit disillusioned with the Western approach to illness.
Well, I was working at a hospital in New York City. And I was actually, when I quit my residency, I was working in the ICU. And the night I quit, I had actually worked all night, and I signed 7 death certificates the next morning. And I felt like I was treating the end stages of diseases. I didn't feel like I was helping people. There was a lot of medical futility. And I also felt like there was a severe fear of death without questioning quality of life. And, the truth is every single one of us eventually is going to die. And, to be able to die with dignity and not in a state of terror or shock, and to be able to evaluate when is the right time to intervene and when isn't. And I didn't see any of those things being addressed in internal medicine. And, no doctor wants to hurt their patient at all. I think every doctor is well-intentioned. But internal medicine, the way it's practiced in conventional medicine is very... you're just treating the symptoms. You're not really looking at etiology and root cause. And I wasn't happy with that. At the same time, I was having severe joint pain, fatigue. Part of it was just residencies, staying up late or working early, all that. At the same time, you're relearning stuff that appeared briefly in medical school and really trying to integrate it into clinical care. So it was very physically taxing. But I ended up having severe insomnia, joint pain, all these different problems. About 10 years later, I was diagnosed with autoimmune disease, but I'm sure it was going on then. And out of desperation, I went to an acupuncturist to help with the insomnia because I wasn't interested in taking, Ambien and all the medications for sleep. And the acupuncture helped me more than anything I learned in medical school. So I quit my residency and I went back to acupuncture school, and I got a 4-year master's degree and became an acupuncturist and a Chinese herbalist. And then for years, I just practiced acupuncture and Chinese herbalism. But like all forms of medicine, it's limited as well. And once I learned about functional medicine and looking at root causes of disease and etiology, I went back to study at the Institute for Functional Medicine, and they had one brief lecture on Lyme disease, and I read Richard Horowitz's book on Why Can't I Get Better? And I discovered that I was walking around with Lyme disease probably for about 20 years. And so Chris and I went and studied with Richard Horowitz. He has a training program for physicians. And then we also learned about mold toxicity, and we're in a mentorship program with Neil Nathan. So like little by little, I've put all these layers onto my practice. And then most recently in the past 3 years, I started studying shamanism and energetic medicine, because so many of my clients have inflamed nervous systems where they're having neuropsychiatric symptoms. And I find that the acupuncture and shamanic medicine helps retrain like the limbic system overdrive better than anything else. So I incorporate a bunch of different layers of stuff in my practice. And I'll frequently do, labs on somebody that look at Lyme, or, antibodies against the brain. And then when I treat, I'll do a vitamin IV with acupuncture, crystal formations around them at the same time. And I use a variety of Chinese herbs and supplements. And everything really meshes quite well together. If you look at the ancient Chinese writings, one of the most respected and revered textbooks in Chinese medicine is called the Yellow Emperor's Book of Internal Medicine. And in the Yellow Emperor, they say that most chronic degenerative diseases are caused by exterior pathogenic factors which never get resolved. And so these are things like Epstein-Barr, which can become chronic. It's exterior pathogenic factors can be viruses, bacteria such as Borrelia, mold toxin. So like none of this is new, and the Chinese knew about it. They just have a very poetic and different language for it. But a lot of the stuff still applies today. And they didn't, people back then, most of them didn't even live to be 40 years old. So the treatments were very focused on acute illness and how to resolve an exterior pathogenic factor such as COVID-19 or something like that. But they do have information in the textbooks about, how to resolve chronic exterior pathogenic factors. And so I've recently started studying sinology, which is the study of ancient Chinese language and characters, with this woman who's got a PhD in it. Her name is Sabina Vilms, and she runs a website that's called Imperial Tutor, and it's fantastic. And so she kind of gives us a glimmer of what's going on in those ancient textbooks, and she works as a translator. But so that's kind of my basis of where I'm at. I got into this because I was sick and I couldn't find a doctor to help me. And so I kept going back to school, and it's just added on layers and layers and layers.
Now, when it comes to these chronic external pathogenic factors that you're talking about, what prevents the body from, say, being able to heal itself from these different conditions? And then, what do you then need to do in terms of medicine to help the body heal itself?
So I think there's a variety of factors. Genetics is one thing I love looking at there. And, I was just at the ILADS conference in Orlando, which is their society that is aimed towards treating Lyme. And there's a ton of genetic factors. Some people will, get a tick bite and they'll get like a huge EM rash, the bullseye rash surrounding like the tick bite, and they'll have an immediate immune response and generate fevers, and they're sick, and they're the ones that get to the doctor. They get treated right away. Hopefully the doctor is aware of Lyme and treats appropriately. But other people, they don't really mount that immune response. And I think it has to do with a combination of things. I think part of it is genetics for sure. In Chinese medicine, we would call that your constitution. But in Chinese medicine, your constitution is not just your genetics, but it's also epigenetics, like what's being triggered because of the situation you're in right now. So, when I was a resident, for example, I was sleep deprived. I was living off Red Bull and power bars. I can't even imagine what my nutritional labs looked like back then. I mean, this was like 20 years ago. So we have access to a lot of boutique labs that weren't available then. So, you know, I think nutritional status, the average American is probably deprived. I also like to look at toxic burden. You know, a lot of people have been exposed to toxins such as heavy metals, pesticides, that kind of stuff. Before I went to medical school, I worked in a laboratory, and we did, I was getting my PhD and taking master's levels classes in what's called microbial bioremediation. And what we would do is we would take toxic waste sites and clean them up using microbes. And so we would get these soil samples that were contaminated either with heavy metals or uranium, and we would extract bacteria that were already present in the soil and look for bacteria that were already reducing the heavy metals or the toxic waste or whatever. And then we would grow them up in mass quantities and then put them back out in the environment to clean up the environment. And it sounds really cool from a day-to-day thing, but it's really tedious. And, you know, I worked with uranium daily in the lab for about 3 years. And I mean, we didn't even consider the heavy metals toxic. We didn't handle it as carefully as the uranium. So I mean, and part of this was because I was 20 years old, wasn't really aware. We followed OSHA protocols. I don't blame the lab or anything, but I don't think there was a deep enough understanding of how radiation affects the biological systems and stuff like that. But in regards to why people don't resolve stuff, I think it's multifactorial. That's a long answer. Sorry about that.
Sure. Well, it sounds like it doesn't have a short solution.
No,
or
it doesn't. Right. And, you know, this is where you can get into like the genetics of detoxification. So, you know, I've got certain genes where my husband and I will both be exposed to mercury. He can get rid of it. I can't. So, and then some people will, it's interesting with heavy metals. There used to be a test on the market called the Clifford test, but the Clifford lab, they closed during COVID. And I think the gentleman that owned it, he was a dentist. He was older and he retired, but they actually looked at immune reactions to metals. So you could just like, you know how some people, they'll wear earrings and get a rash on their ears, or they'll wear a belt and get a rash from the belt. That's often a nickel allergy. And you can do blood testing to see IgE reactions to nickel. Well, imagine if you have nickel in your body and you have an immune reaction to nickel. So something's within your body and constantly causing an immunological reaction. And so just like you can have antibodies to bacteria and viruses, you can also develop antibodies to metals. I suspect some people have antibodies to plastics and other toxins as well that we haven't even become aware of. And I really strongly suspect diseases like fibromyalgia. I suspect what fibromyalgia is an autoimmune disease of the connective tissue, and we just don't know what the antibodies are.
Yeah. So in terms of something like fibromyalgia, yeah, like a Western medicine approach or diagnosis, if you were to Google it, they don't list, you know, what specifically is actually causing it. They don't know. So it makes sense that one of these other theories.
I used to get in trouble as a med student for asking etiology of those kind of diseases.
They're probably mad because they
but I
don't know
think
the
it's
answer.
important to think about, you know?
Yeah. Yeah. I mean, I would assume they're just getting mad because they don't actually know the answer and they don't want to appear stupid to their students. So,
right. So, but you know, for my fibromyalgia patients, and you know what's fascinating, Toby, is the fibromyalgia is diagnosed by point tenderness at specific points, and they're all acupuncture points, which is fascinating. So there is overlap that goes on with a lot of this stuff. And the way I practice, I try to hold multiple paradigms in my mind simultaneously. So I'll have a Chinese medicine diagnosis, I'll have the functional medicine diagnosis, I'll be thinking about the genetics of detoxification, but then I'll also look at energetics as well. emotional trauma, those kind of patterns as well is a also part of a big part of what goes on.
And yeah, so in terms of that, like if, if you were to have a patient walk into your office and they're complaining about, say insomnia and fatigue and pain and, just a myriad of different symptoms, and you're integrating all of these different approaches, schools of thought, different therapies, like just, can you walk me through kind of how you would approach, just beginning with the patient?
Yeah, so it's interesting. Certain patients will just book for acupuncture, and if they come in for acupuncture, I just approach them from acupuncture, and then I'll ask, hey, are you interested in testing for heavy metals? I suspect it might be this or that, and then sometimes they'll convert over to functional medicine. Some people come in just for functional medicine. They're not interested in acupuncture. They're afraid of needles. And some people respond very poorly to acupuncture. And just like I was saying, like some people can have immune reactivity to metals. I suspect those people are probably the ones that respond really poorly to acupuncture. I think there can be physiological reasons for that. But I try to read the patient and see what they're interested in. And I also believe strongly in options counseling, because we're all unique individuals, and just because something worked for one person, it doesn't mean that it's going to work for another. So I discuss a variety of treatment options with them, and I let the patient choose.
So in terms of when you look at just kind of people's lifestyles, it's obvious that we're obviously, most people are eating pretty poor food, highly processed food, high in sugar, maybe not exercising enough, getting too little sleep. What do you see as some of the biggest assaults to our health kind of in our Western world nowadays?
Well, I mean, you named it, sugar and processed foods. And I mean, if you look at sugar and the history of sugar too, it's one of slavery. I mean, we brought slaves from Africa to work the sugarcane fields in Cuba and America. And if you look at, I mean, if you've ever been around somebody coming off sugar, there is a withdrawal. And I think the energetics of sugar is enslavement. And I mean, if I have a ton of sugar, I immediately feel sleepy, cognitively impaired, brain fogged. And I mean, it's easy to induce slavery for somebody if they're doped up on that stuff. And that's truly the energetics of sugar. Cutting that out of the diet can be extremely difficult for people. And there's a process of doing it. But once my patients come off it, they feel so much better. And then they'll have one cookie and they feel awful. Gluten is a common inflammatory thing as well. We do a lot of food allergy testing because I find it super helpful for clients, especially if they have multiple food allergies, because sometimes people will be trying to keep a food diary and they can't tell what it is. One of my autoimmune diseases, I've had multiple ones, was Crohn's. And I actually had a fistula, and it was awful. A fistula is a hole between your intestines and your skin that's not your anus. And so people will leak feces. And I had a fistula for about 3 years. And I did food allergy testing, and I had severe allergies to 19 foods. And I cut those foods out, and within 2 weeks, my fistula healed on its own. And, I was told by other physicians that, you need Remicade, there's no way you can ever fix this and that. And that process of cutting those 19 foods out, at first I was like, oh no, what do I eat? And there was a definite deer in the headlights feeling for about a week or two. But I was so sick, I didn't care, I was going to do it. And, some people need a lot of hand holding. I refer them to a nutritionist if they want that. Some people, it's very simple. It's like, okay, you cut out gluten and dairy and they're 50% better. So it's different for each individual. My case was severe because I was looking at a colostomy bag So I was willing to try anything to avoid that. Yeah, I mean, nutrition is key to it. Now I basically eat a modified paleo diet, but grains are big triggers for me, but other people do fine with certain grains. So, I find each individual is unique, and you really have to find your way with it individually. And that's why I do like the food antibody testing. And we test both IgG and IgE. Just the food sensitivities, you miss a lot of the true food allergies, and a lot of people have both. But
Can you sort of break down the
yeah,
distinction between both, like both food allergies and then food antibodies?
Sure. Yeah, IgE is what is a molecule that mediates true food allergies. And true food allergies are quick reactions. So people who eat peanuts and then get hives, or people who eat strawberries and their lips blow up, or somebody like gets a bee sting and they get an anaphylactic reaction. Those are all true food allergies. And they're quickly, the antibodies happen quickly and they go away quickly. So, they'll break out in hives. The next day, though, the hives are gone, or they take a Benadryl and it's better. So that's a true food allergies. That's an IgE reaction. But a lot of people have low-level reactions where they don't feel hives, they don't feel their throat closing, and they'll just get like itchy skin, or they'll get like fatigued and stuff. And when we do food allergy testing, it'll show up as an IgE reaction. Now, there's a second type of food antibody, and that's called a food sensitivity, and that's an IgG reaction. And IgG is an antibody that the half-life is 21 to 29 days. So what that means is that in 21 to 29, let's say you eat a piece of cake and you have IgG reactions to the gluten in the cake. In 21 to 29 days, half of those antibodies are gone. So it's a low smoldering reaction. And, for my Crohn's, I had both IgE and IgG antibody reactions. I find with inflammatory bowel, cleaning up the diet is extremely important. Otherwise, you've got to cut those the reactive foods out. But the problem with the IgG is, like, people try to keep a food diary, but because the reaction is low and smoldering, you can't really tell, because it could be something that you ate a week before. And then imagine if you have 5 of them, and if you have 5 of them in the same day, like, everything will crescendo, but you'll be like, oh, but it can't be eggs because I ate eggs a week ago and I was fine. So that's where the importance of the antibody testing for foods come in. And I find it really has impact on neurocognition, the mental clarity that people feel once they cut reactive foods out of their diet is they're so happy. Yeah, and it's sad when eating becomes inflammatory. We have certain clients where they're severely sick, and we'll even do short courses of elemental diet. And elemental diet is basically food it gives you all your amino acids, all your basic nutrients, essential fats, and it's easily broken down in the stomach. So it's quickly absorbed in the first part of the small intestine. So allows the rest of your GI tract to repair and heal itself. If you've ever seen somebody who's in the ICU who gets a feeding tube, that's what they're giving them, is like an elemental diet. And there's one called Vivanex that they use in the hospital that tastes horrible. And then there's another one that kind of tastes like orange tapioca powder. That's for people who are not intubated and sedated. But even that is coconut based, and some of my clients are allergic to coconuts, a tree nut, so it's a common food allergen. But I find a short course of elemental diet for inflammatory bowel disease can be life-changing, because it really just calms the gut inflammation down. And there's a huge tie between your gut and your brain, all those neurotransmitters that get created there. I don't recommend long courses of it unless somebody has SIBO or something like that. But short courses, some of our patients really feel much better with a short reboot.
And you mentioned just the increase in cognitive clarity from kind of cutting out some of those foods that might be kind of creating this sort of low grade inflammatory response in the nervous system. Was wondering what other factors, when someone comes into you and says, I'm experiencing a lot of brain fog, I can't, think clearly, my mental clarity is not what it used to be. What other factors might be at play besides, the foods that they're eating?
Well, I always think about insulin levels. Even your brain actually runs really well off ketones and fats. And if people are eating high carb diets, sometimes that's a huge factor. So I always think about that. I think about heavy metals. I think about chronic infections that can cross the blood-brain barrier and cause, low-grade brain encephalitis. They had a big discussion this weekend when I was at the ILADS conference on multiple infections that can cause this type of encephalitis picture. In children, there's a thing called pandas, and the classic picture was they would catch a strep throat, and then the kids would develop like severe neuropsychiatric symptoms and like total behavioral shifts and stuff like that. But there's other things than strep throat that can cause pandas. And PANDA stands for, like, I think it's pediatric, autoimmune, neuropsychiatric. Oh my gosh, now I'd have to look it up. I'm sorry. But it's basically brain inflammation after an infection. And there's actually a really cool lab. They're called molecular labs, and they developed a test called the Cunningham panel that looks at antibodies against the brain that can be developed in these kinds of things. But it's multiple infections, including Borrelia. Bartonella is a common trigger for people. And often they'll have a variety of stuff. But it doesn't just happen in children, it can happen in adults too. I see it a lot in Epstein-Barr, HHV6, and cytomegalovirus. And, Chris and I, we'll look at antibodies against viruses, but one of the problems with antibodies is, like you might have gotten chickenpox when you're 5 years old, and you break out in the initial rash and everything, and you're itchy and you have a high fever and miserable, and then it goes away, right? Well, it doesn't really go away. Your immune system maintains it in a latent state until maybe 60 years later, you're going through cancer treatment and you're getting chemotherapy, and next thing you know, you break out in shingles, right? So it's the same virus. Well, certain viruses can reactivate, and they never really leave our body. Epstein-Barr is, so herpes zoster is what we call shingles. But all the herpes viruses can cross the blood-brain barrier. And, herpes 1 will cause like the sores on the lips. Herpes 2 traditionally is genitals, but we know you can get either one in either place. Human herpes type 3 is cytomegalovirus, which is actually primarily a lung infection. Epstein-Barr virus is human herpes type 4, which is really like a mononucleosis picture. But you can have mono, when you're in high school, severe fatigue for a month, and then 30 years later, you're going through a divorce, you're exhausted from the stress, maybe finances change, you're not eating well, not sleeping. Next thing you know, you get reactivation of Epstein-Barr. So, you can look at antibody levels. If antibody levels are high, you can think, well, maybe this is a reactivation. But there's a really cool lab we use. They're called infecto labs, and they look at T cell reactivity to determine if an infection is active. And I find that's a super useful test for people who are brain fogged. If we suspect any kind of tick-borne co-infection or something like that, I'll run infecto labs. And infecto labs has like a viral panel. If you don't suspect anything tick-borne, you could just look at the viruses as well. I look at that when people come in when their chief thing is brain fog, Occasionally I'll look at some of these bizarre toxins. We don't get a lot of people who used to work in labs like me. We have a couple other clients who used to be scientists, particularly chemists. They get high toxic exposures just for their jobs. I had one guy, he was working with a lot of toluene, and there's some weird boutique labs where we can measure those kind of levels. But unless I have like a distinct occupational exposure for that, the labs are expensive. They're about $700 to $1,000. And unless I really strongly suspect it's going to help drive my, how I treat clinically, I don't really order it. Unless the person's super interested. I mean, some people are like, oh, I have plenty of money, I want to run every test. Okay, great. You want to see, we can look. But usually I look at nutrition, infections, gut health, and heavy metals. Those are really the things. And then I'll start to layer in, things like brain tap. Are you familiar with brain tap?
I don't believe so, no.
It's this super cool device, and it seems like such a gimmick, but it works amazingly. So it has like headphones that you put on, and then it has like a visor that comes down like you're a jet pilot or something, and and you keep your eyes closed, and it flashes lights at specific frequencies, and it helps you enter different states. So they have like an alpha state for like creativity, a theta state for meditation, and a delta one for sleep. And some people, their brains forgotten how to go into these deep sleep experiences. And so I find the brain taps really helpful if somebody's got severe insomnia. And it's this really cool device, and they combine hypnosis with neurolinguistic programming and positive psychology, and they use binaural beats. And I think it's multiple technologies combined in one device. So the way I see it, it's training for your brain. Just like going to the gym is like training for your muscles. And the first time you go, you're like, oh my gosh, what do I do? This and that. But after you've been going for a year, you can't imagine not exercising. Well, the brain tap is, because I get a lot of people like, if I tell them to go take a walk on the beach and meditate, they'll be like, but I can't stop thinking. And the brain tap is training wheels for that. It's a pretty cool device.
That sounds kind of similar to a device that I use, classified under audiovisual entrainment, that I use in my company. And yeah, a lot of that's similar, where you got the visor, you're listening to tones coming through the headphones. So I'm
cool.
Yeah, I'm a big fan of, yeah. So when it comes to, talking about, say gut health, besides nutrition, or I guess, I mean, in the regards to nutrition, besides cutting out foods that, might be pro-inflammatory, that people might be allergic to, what are your thoughts on, say, prebiotics and probiotics, fiber, what are all the other components that go into gut health?
Geez, there's so many. Well, there's a couple things I think of in regards to gut health. First, I want to make sure the person doesn't have a parasite. So I do a lot of stool analysis, and there's certain things that light up. I mean, sometimes, like, when they do the DNA analysis, it'll be like, okay, you have Clostridium difficile. It's like, okay, I have to get rid of that. So the way I think about it is like, what are you missing? What do you need? Like nutrient deficiency. And then what's there that's not supposed to be there? So you give the person the stuff they're missing, and you take away the stuff that's not supposed to be there. So the stuff that's not supposed to be there are like the foods that cause the allergies, any kind of parasites, any kind of like, just processed junk too. I mean, like, get that stuff out, and then give people really good quality stuff that they can digest. Now in Chinese medicine, they don't eat a lot of raw foods. They don't eat a lot of salads. I find that my really sick patients need to eat cooked foods, because cooking is chemistry, and it's much easier to digest foods that are cooked. Certain people who have a lot of what we call stomach heat in Chinese medicine will do well with raw foods diets for short periods of times, but I find that eventually they can be depleting, harder to absorb nutrients and stuff like that. But I look at all of that stuff. I do like prebiotics. I do like probiotics in the right patient. You know, if a patient, Chris and I also treat a lot of what's called SIBO, which stands for small intestinal bacterial overgrowth. And we also treat a lot of fungal colonization in the GI tract as well. And, you know, when we find evidence of either of that, you have to be careful because probiotics, certain probiotics can make SIBO worse. And certain people with mold toxicity and fungal colonization, you know, some of that healthier fermented foods that are really good for everyday people make your mold toxin patients worse. So, you know, kombucha tends to make mold toxin patients worse because, you know, it's made from a fungus and this kind of stuff. So it's really so individually based. But the way I look at it is what's missing, what nutrient or what thing do you need that's not there? And sometimes it's not a nutrient, it's the parasympathetic stimulation. Like the rule is rest to digest. And, you know, that might be the missing component. You know, I had one lady, she had a super stressful life. And at the end of the day, she would drink alcohol to decompress. And she started drinking too much alcohol. And so what she needed more than anything was a new ritual for relaxation before she sat down and had dinner. So, you know, she made a new thing where she would take a walk with her husband and watch the sunset. And that was her new glass of wine. And, you know, I mean, alcohol, it was a huge factor in leaky gut as well. And then, I mean, there's so much going on with gut health. Was that helpful though? But I basically looked at what's missing and then what's there that's not supposed to be there, whether it's a parasite, a worm, inflammation, you know, processed foods, that kind of stuff.
Okay. And when it comes to like clearing out some of those like parasites or infections, those kind of chronic infections that we've talked about, you know, what, I guess, besides like nutritional therapy, or we touched on, you know, acupuncture, what are some of the other, you know, therapeutic approaches that you like to use in your clinic?
So I'm a Chinese herbalist, and I use a lot of Chinese herbs, and they're very rarely do you give one herb by itself. In Chinese medicine, they're very interested in the relationships of herbs. And it's interesting when you construct a Chinese herbal formula, there's like a structure to it. And a certain herb will be the principal herb, which is like the key thing that you want to do in Chinese medicine. So it could be like clear damp heat from the intestines. And the diagnosis of damp heat is like foul smelling stools that are loose, tendency to irritability. I mean, there's a whole like criteria for the diagnosis of that particular pattern. And so you might choose a particular herb to clear heat in the intestines. So like a common one that we choose is Huang Qin and Huang Lian, which is Coptis and Huang Qin. They're like the yellow herbs that have the berberine. And then there's another yellow herb. Huang means yellow. So there's Huang Qin, Huang Lian, Huang Bai. And then there's another herb that's a gardenia fruit. And it's such an elegant formula. There's only 4 herbs, but it clears the damp heat from the intestines. It's been used for centuries for dysentery in Chinese medicine. The name of the formula is Huang Lian Jiedu Pian. But I'll use that if the patient meets the correct Chinese medicine diagnostic criteria. So this is where the Chinese medicine kind of overlaps, but not exactly. It's not like, okay, you have this, you have this biomedical, let me give you this herb all the time. So it doesn't work quite like that. Now I do, I do use the energetics of Chinese herbs. I've also studied Stephen Buhner's books, and I studied with his partner, her name is Julie McIntyre, in regards to Lyme disease and herbs. And, you know, he takes a very interesting approach. He takes what's called a cytokine approach to herbs. So he looks at how herbs modulate the cytokines in the body. and he will prescribe according to that. But what I'll do is I'll take some of the cytokine information and I'll layer on the Chinese medicine energetics. For example, certain herbs, while it might have the right cytokine profile for you, they might be too hot or too cold for you, depending on your particular constitution. So I find the herbs come in really well. And we find in our practice that, certain times people are really sick and they need antibiotics, antifungals, pharmaceuticals. But when you give the pharmaceuticals with the Chinese herbs, the eradication of the parasite is much more successful, from what I've seen just in my clinical practice. And there are certain cases where I worry about drug herb interactions, but it's only certain drugs. And in general, I find they work synergistically much better. I remember one client years ago, he was immune compromised and he had a chronic Giardia infection, and Giardia is a type of amoeba. And he had taken doses and doses and doses of conventional pharmaceuticals from his doctor, who was well-intentioned trying to help him, and nothing was working. The poor guy had chronic diarrhea, and because he was immune compromised, he couldn't get rid of this infection. And we layered in some Chinese herbs with it, and he was able to actually eradicate the infection. And I mean, he had had Giardia for over 8 years. So, the kind of taxing strain on the body that kind of chronic infection does. And it's interesting too, the parasites will have different cycles. I think that where they'll flare and then they'll kind of go into a quiescent stage and then they'll flare again. And I find that a lot of these are on a lunar cycle. So if we have somebody where I'm sure they have an infection and we can't catch it, I'll actually draw blood on the full moon to try and catch something like Lyme and stuff like that.
Interesting. And I thought it was really interesting, just what you mentioned with Chinese herbs, where it's these, crafted kind of combinations with different ratios. That's very contrary to, when people think of traditional supplements, where it's, you're usually, getting one thing, kind of isolated, or, that's an interesting kind of change in approach.
Yeah. Oh, totally. Because I got distracted. So the first herb will be the principal herb. The second herb will kind of support the action and mutually enhance. So certain herbs will mutually enhance each other. And then often the third set of herbs are envoys. So they'll direct it to certain parts of the body. And then the last set of herbs are often like harmonizers that make all the herbs in the formula get along. And so it's fascinating. And, some of these elegant formulas that they're like 4 herbs or 6 herbs or something like that. But it's so different than here's your berberine. It's a very different energetic. Yeah. And this is where you get into things like, if you ever go to France and you talk to people who are in the wine industry, there's the terroir of the wine. So certain regions, the minerality of the soil has will evoke a certain taste in the wine. And the weather that year, maybe it was good, maybe it was bad. The crop is better, the crop is worse. Same thing goes on with herbs. The mineral content of the soil in certain parts of China, like this herb in this part of China was known for this, but the same herb that was grown in Sichuan has different properties. And that has to do with, soil health and the geography and the weather patterns, and it'll change year to year too. And this is where, you can have problems with essential oils too, with the same thing. It's the crop one year will be different from another. And the biochemistry of the plant is not going to be the same every year. And then when you think about essential oils, you're using the, in chemistry, like dissolves like. So, a lot of the Chinese herbs were boiled in water. So you're getting the water soluble parts of the plant. When you're dealing with essential oils, you're getting the fats from the plant. So it's all, and sometimes the essential oils will have very different properties than like the decoction or the tincture. And I think there's not enough awareness of the differences in the biochemistry of all that stuff.
Got it. Got it. Well, Emily, we're coming up onto the end of the show. The last question I wanted to ask you, when it comes to kind of looking towards the future of medicine and kind of as some of these therapies maybe move their way more so, or not just therapies, but kind of this approach of, functional medicine, combining all of these different modalities and treatments, where like, what are some of the most exciting avenues, or like, where do you sort of see this sort of field going in the future?
So for me, I see the best results clinically when people mix and match modalities that resonate with them. And often, they're mixing sound healing with vitamin IVs, with nutritional changes, with eradicating infection. And I think we need to develop a truly integrative medicine where doctors have awareness of like the psychospiritual aspects of disease. Chronic infections, it's a type of entity possession. It's like something that's there that's not supposed to be there. And I even think sometimes there's energetics in the etheric field that need to be addressed. And I think what really needs to happen is mutual respect among it all. Respect for Western conventional medicine has amazing diagnostics. MRIs, CAT scans, they're fantastic things. Often the treatments are not good, but I think there's a place for it all. And what I would love to see develop is truly integrative medicine and just bringing all the healing modalities together.
Awesome. Well, Emily, I really enjoyed our conversation today. If listeners want to learn more about your practice or your you just personally, where would you direct them to?
So we have a website. It's called it's www.miamibeachcwc.com, and that stands for Comprehensive Wellness Center. And there's like a short like about us page, and that's probably the best place to go.
Awesome. And for the listeners who enjoyed the show today, go ahead and like and subscribe to our YouTube channel, Roscoe's Wetsuit Neuro. You can also find audio versions of the podcast available on Spotify, Apple Podcasts, or any of the other major streaming platforms. Go ahead and give us a 5-star rating. We would really appreciate that. And if you have any comments, suggestions, or requests for any specific guests on the show, go ahead and shoot me a DM at Roscoe's Wetsuit Neuro on Instagram. Emily, I wanted to thank you again so much for coming on the show today and sharing all of your knowledge and expertise.
Thank you so much for having me. I really appreciate you inviting me.